Namaste all of you. My name is Dr. Ritu Singh Rajput, Faculty of Agriculture and Veterinary Science. Today's topic is tissue and organ transplantation. As before our previous lecture, I have told you about different kinds of plant transplantation and different types of transplantation and different types of grafts like isografts, xenografts, split transplantation. And today I will tell you about the remaining transplantation like domino transplants. The operation is usually performed for the cystic fibrosis as both lungs need to be replaced and it is technically easier operation to replace the heart and lungs. As the recipient's native heart is usually healthy, this can dam itself be transplanted into some needed to heart transplant. Major organs and tissue transplanted: chest, heart, lung, heart-lung, and abdomen, kidney, liver, pancreas, intestine, stomach, and testes. Tissue cells and fluids: hand, cornea, skin, islets of Langerhans, bone marrow, and heart wall, and bone. Types of donor, living donor. In living donor, the donor remains alive and donates the renewal tissue, cells and fluids like skin and blood, or donate an organ, primarily single kidney donation, partial donation, liver, lung and lobes. And disease donor are people who have been declared brain dead or whose organs are kept viable by ventilator or other mechanical mechanism until they can be accessed for transplantation. Timeline of successful transplant. These are some successful transplant in like 1988, first transplant of kidney in 1999, 1999, first recorded kidney transplant 1996, 1936, first human kidney transplant 1953, first successful surgery using heart lung bypass 1954, first successful kidney transplant 1963, first successful human lung transplant 1967, first successful liver transplant 1968, first successful heart transplant in US. 1973, first successful bone marrow transplant. 1998, first successful hand transplant. Heart transplant procedure. When an organ that meet your requirement is located, the transplant doctors will be checking the donor organ while you are being evaluated and start or medication in preparation of transplantation. If a donate organ is good, you will be then be take the operating room or put to sleep with an anesthetic, and one of the transplant surgeon will being to the process preparing the chest cavity for removal of your heart. And transplant rejection, hyperacute, occur minute to hour after transplantation, no treatment. Acute occur days to month after transplantation. The cytotoxic lymphocytes attack to the transplant organ. Chronic occur over months to years. Most common in lung transplant. Signs and symptoms are pain at the site of the transplant, feeling ill, flu-like symptoms, fever, weight change, swelling and disease, urine ox. Immune drugs are in transplants are corticosteroids, prednisolone, hydrocortisone, and calcium inhibitors like cyclosporine, talosmip, and antiproliferative and MTOR inhibitors. Organ transplant is the successive therapeutic option of the treatment and stage organ disease. Success depends on the improved surgical techniques, immunosuppression, organ prevention, and follow-ups. So this is whole about the transplantation of organ and tissue transplantation. I hope you are satisfied with this session. If you have any query, write down in comment box. This session is powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University. Thank you.